Good morning. Thank you for the opportunity of presenting. I have nothing to disclose. As we all know, preoperative anxiety is highly prevalent in our patients. It presents in 60 up to 70% of the patient that's scheduled for surgery. And anxiety is a normal response, but studies have shown that high anxiety levels correlate with higher rates of postoperative complications and lower patient satisfaction and quality of life scores. So as we can imagine, gradual exposure to a stressful event, in this case surgery, can reduce relating anxiety and depression in these patients. In fact, patients that have undergone surgery before have lighter responses to the next procedure that they undergo because they adapt. So in this sense, virtual reality offers a possibility for the patient to experience every state of the operative process in a stress-free and very realistic way in a more relaxed environment. So the objective of our study was to create an individualized virtual reality program to gradually expose the patient and prepare him for the surgical process. And then our goal was to assess the efficacy of this intervention in decreasing the preoperative anxiety. So we conducted this study at our hospital in Barcelona. We started recruiting patients in April of last year and finished in January of this year. The inclusion criteria was patients that were scheduled for colorectal cancer surgery with an ASS score of 1 to 3. Exclusion criteria were previous abdominal surgery in adulthood, indication for permanent stoma, or neurological or visual impairment. Once the patient met the inclusion criteria and was willingly set to participate in this study, there was signed consent and randomization. So up to the point of this, the analysis for this abstract, we included 65 patients with a mean age of 76.8 years and a gender mostly male, 66%. Now we're close to 126 patients recruited. And after randomization, 27 of these patients were allocated to the VR group with a mean age of 64 years and again, male predominance of 55%. So this is what we did. The patient had a first contact with the virtual reality through these goggles that were designed with our AV staff, and was shown an informative video of the hospital environment. This video was designed with medical, nurse, and administrative staff. This is a shorter and much accelerated version, but this is what the patient sees in a 110-degree field. The entrance of the hospital, the surgical floor, the nurse, up until the room. This is the nurse that will be giving the patient care for the next few days. Now we can see one of the surgeons, this is Dr. Otero, answering any last-minute question that the patient might have the day prior to the surgery. This is the morning of the surgery, the patient going down through the hospital halls down to the OR ward. This is probably most nerve-wracking moments for the patient right before the surgery, going through these halls, then parked at the OR gate and received by the anesthesiology nurse, as we can see here. And then finally, the patient gets inside of our OR and is greeted by the anesthesiologist, nurse, and one of the surgeons. This is moments just prior to the induction. The next thing the patient sees, one of the surgeons in the recovery room asking how he's doing and telling him that procedure went well. So that was the first part that we do at the outpatient clinic, and the next part is probably the most interesting. The patient gets granted access to a mobile app that is downloaded directly into the phone and is presented with virtual reality cardboard viewers. Unfortunately, we're not able to give them the goggles, the fancy goggles that we saw before. But this is the raw vision. They have a system that allows them to access 24 hours a day, as many times as they want, all the information divided by sections. They get to access all of this. The surgeon, the anesthesiology, the stoma nurse, the OR, they get to see everything as much as they want. This is what we used to evaluate what we did. We used 2 validated questionnaires, the Hospital Anxiety and Depression Scale and the State Trait Anxiety Inventory that were given to the patient once at the outpatient clinic after the diagnosis and the patient was offered the surgical treatment, and then at admission after 2 or 3 weeks of the VR exposure. So these were results. Basal score were comparable between non-VR and VR groups. There were no difference between genders. And interestingly, no difference between patients older or younger than 65 years old. That was one of our concerns with this technology. Analyzing by numbers, we can see here one of the scores. The Hospital Anxiety and Depression Scale, both for anxiety and depression, the scores went down after VR exposure. This was not statistically significant, probably because we had a small number of patients at the moment of analysis. And then for the State Trait Anxiety Inventory, we had the state anxiety, that is the one that refers to the patient in response to a stressful stimuli, such as the surgery. This went down, and interestingly, the trait anxiety, that refers to anxiety more of a baseline day-to-day basis, this went down also, and we saw that it was statistically significant, probably because the overall anxiety level of the patient goes down with this exposure. That was a nice surprise and very interesting. So up until now, we can conclude that virtual reality seems to be a promising tool in reducing preoperative anxiety, but of course, larger studies are required to fully validate this strategy. Age, surprisingly, it does not seem to affect the patient response to this technology, and the goal is to extend this application to different surgeries and even medical scenarios. Thank you.
Are there any questions?
Hi, Priya from Emory in Atlanta. We spent a lot of time at our institution talking about interrelatedness of anxiety and pain. I was wondering if you had any data on pain scores after this exposure.
Not yet. That's once we get this project going and with larger scales, that's one of the parameters we need to assess. Yes.
Thank you.
Yeah, kind of dovetailing on that, anxiety is a negative aspect maybe a patient will have of the surgical experience, but do you plan on gathering any data about confidence in the surgery process or in their team and whether the VR changed that?
We have sort of subjective data on that because the patient definitely feels more comfortable with a team when they see who they're being operated by, the faces, everything, it's familiar. One of the patient's concerns is, who's gonna operate on me? I don't even know this surgeon. I was greedy about someone at the consult, now I see someone else. Another resident surgeon is gonna be taking care of me. So I think this gives the patient the possibility of knowing the team and maybe feel more comfortable with the whole process and the surgical staff once they know everybody.
Thank you.
Quick comment and question. So shout out to my wife, who's a psychologist at the VA, our Veterans Affairs Hospital. They're actually piloting something very similar, not just limited to surgeries, but to their whole process navigating the VA, which is a very complicated system to begin with. Because the patients are at a higher rate, or they have a higher rate of PTSD, post-traumatic stress disorder. One issue that they noted early on is higher rates of nausea with these VR systems. Did you guys notice any complaints from the patient?
Not really, because as I said, we present the VR goggles that are nausea-inducing at the outpatient clinic, and we didn't really notice that. And then the next part is done at home with a cardboard viewer, sort of a makeshift goggle. We don't really have cases of nausea, even in early patients, but maybe once we get the data for the whole 126, we can address that better.
Okay, well, quick shout out to my wife, who's a psychology trainee at West Virginia University.
Perfect.
When you're a surgeon living with a psychologist, life can be hard.
We can chat. We can chat later.
So is there a psychologist on board with study design for this?
Yes.
Yeah. Good answer.
Yes, yes.
That's what I say at home too. Yes.
Thank you.
Thank you.